Okay, so now we've talked and discussed cumulative loads, and these are loads that can be then internal loads to the different tissues. Let's talk about this in terms of over a period of time, like a season or training, where you're really wanting to optimize the stimulus that you provide to that tissue so the tissue responds in a positive manner without getting an injury. And so really what you'd like to do then is monitor individual loads and monitor them over every session, and then try and understand, well, what is the total cumulative load that's being placed on the tissue. So some examples of this might be to understand a fatigue-related injury like a fracture. So if you're a basketball player, you're playing a high-intensity sport, you're experiencing lots of load, bone typically likes that, that's good, but it's important to have rest and recovery periods that are timed just right so that you don't have a cumulative load that leads to an injury. So the bone is responding to those loads that are being applied to it. If you don't have enough rest in between these loading sessions, then you might set up yourself for a fatigue-related injury. So what's important here is then the management of workload, and of course we're talking about the internal loads that are the forces that are placed on the different tissues. And so what you really want to do here is understand what kind of loads are placed on the tissue across each different testing session. Training sessions, during competition, you really want to know what are the loads and what is the load history so that you can manage your players to ensure that they have enough rest. Now, one great example of this would be the difference between acute and chronic loads. And when I talk about the acute and chronic here, I'm talking about the loads in one session. So you have a really hard training session, that would be an acute load that's placed on the body and placed on the tissues, as opposed to chronic, which is the cumulative load over multiple sessions. And what you'd really like to do is measure and monitor these loads in a way that you can then optimize your training to minimize the risk of injury and obviously improve performance and improve the strength of tissue. And one good example of what we're doing right now is in terms of return to play. You have an injured athlete who's experienced a fatigue-related fracture, and we want to then bring that athlete back. Now it's important to know then, well, how much load is this athlete experiencing? What's the magnitude, what's the size of the load, and what's the cycles of load that this person's experiencing? So for that, we need to have one sensor per leg because we're interested in left to right differences. There might be asymmetries, there might be, favoring one leg over another. So we can do that. We can estimate then the individual loads and the frequency of that loading over not only one session, but over an entire season. And then we can use that to help manage the workload and bring your athlete back from an injury.